I'm pretty used to being by myself. I'm pretty independent. But when you start talking heart issues, there's a few things. At times I get a little nervous, and I suppose the hospital thought they were doing the best they could. You know, the call the day later, but what is it, a 1-minute phone call or whatever? If you have any problems, come on down here again. Well, I was just in there. I don't want them to stay out of the hospital.
What we realized at Cheyenne Regional about 10 years ago was that the way we had traditionally delivered care, the way hospitals had traditionally delivered care, you took the very best care you could of them while they were in the hospital, and then you wheeled them with dignity to the door and said goodbye to them when they left, and in the back of your mind maybe knowing, well, we'll be here when they come back. And our care stopped at the discharge. We began to realize at Cheyenne Regional that wasn't okay with us. We began to think about people and community-centered care, which today is often known as population health. We began to think through, if we were going to transform the way we were doing it, what would we need to do? There were a few programs that came out of our efforts to operationalize that definition of community and people-centered care. One of those programs is called TACT, Transitions Across the Community Teams. These are specially trained RNs that follow the patient in the hospital, but they also follow the patient after the discharge. And their purpose is to make sure when the patient goes home that the patient understands their diagnosis, that they understand their care plan, that they can self-manage their care, and perhaps most importantly, that they understand their medications, how to take them and when to take them. Then the TAC nurse really goes to work. This is where the TAC nurse begins to identify those other services, those health-related social services that a patient needs to be able to stay at home in the community and continue to heal.
One of our community partners that we work very closely with is LIVE. LIVE is comprised of a social work team, and they really help our patients that have some social barriers to improving their chronic illnesses and staying healthy. And we identified that this group was out there, which really helped our TAC nurses be able to focus on more that clinical, that medical side of things.
So to go into someone's home and actually see the environment that they're living can often shed light in a whole new way on what the patient needs. So to have a nurse go into a patient's home and to be able to team with that nurse with case management type services, behavioral health services, and then coordinate back with the provider, to me is the absolute ideal way to care for people and keep them as healthy as possible.
We try to help every way we can on an outpatient basis. We try to look for resources that might benefit someone that could improve their health by being more consistent with taking medications, trying to find resources that can help with anything, because it seems like that's one barrier that a lot of, tends to be a barrier, is when somebody is worried about, when we're housing, or worried about, how they're going to get their medications because they can't afford it. So just trying to find every which resource we can, trying to find what we can do to help them, be more consistent with taking medications, getting their medications. I've been working with Glenn for over a year. I remember that first home visit and the surprised look on his face that said, "You came." It was truly amazing that I got that kind of reaction, and I do get that quite a bit too. I think they're surprised that we'll actually come and try to help out when we can.
Before, over the last years, when I'd go in the hospital, I'd get out, and I live alone, then I'm by myself, trying to figure out. In fact, I'd have to call a few times to nurses to find out what a bunch of the medicines were all about, because nobody had really completely explained them. Now, after I met Allison, not only does she come and see how I'm doing, she makes me this little list. I carry my billfold with all the medicines on. Last year in June, I went down for one of these ablations in Colorado, in Greeley, and the hospital here forgot to send my records down, and they asked me, I said, I can't remember them all, and I said, wait a minute, I've got this in my billfold. I pulled it out, and the gal that went through it thought that was the neatest thing, and I said, well, thanks to Allison.
Communication is very challenging. I think that's trying to coordinate care between the provider, between if they have a home health agency, if they have specialists, if they are seeing doctors in Cheyenne and as well as Colorado and they live in Laramie, and how to get all those providers to communicate with each other, with their pharmacist. That is a very difficult thing to do.
With this program, we have been able to show that our readmission rates are lower, that we have increased patient satisfaction, that our patients are not just coming back to the emergency department, they're being well managed in our community. And so through that, we're able to get the support of our administration to know that this is a good thing, that we're really keeping our patients healthier and keeping them as active, healthy members of our community. Our TACT program has been built into the budget out as a result of the positive outcomes that we've been able to show.
Don't be limited by we've always done it this way and nobody's going to pay us for that. Talk to a lot of people. Ask a lot of people. Take advantage of any flexibility that your local or your statewide payers might be interested in getting into some sort of demonstration model with you. Don't skimp on the early planning. Identify the data that you're going to use to prove that your model is working. Do that first. Get everybody to buy into the metrics that you're going to measure success against, and then go find the most committed people to delivering healthcare a different way and bring them to your party.
This is the next phase of healthcare. This is where we're headed. We can't just provide that care within the walls of the hospital setting.
These kinds of relationships is where healthcare has to go in order to be sustainable.
If you can get those resources into place, then it does tend to reduce a lot of stress. The benefits of having that relationship with your patients is they know you're there for them and will always be there to support them in their health needs.
The best thing about being hooked up with Allison since I met her is that it's not that one phone call after you leave the hospital, and numerous times to have somebody checking in or I could call. I mean, that just means the world to me.